Hi everyone, I'm Christy and I'm going to be talking about the family life cycle theory, expanding to include voluntary child-free couples. I just wanted to give you guys some quick facts before we dive into the meat of this. The birth rate is down. It's the lowest it's been since 1976, with 59 births per 1,000 women, ages 15 to 44. In 2008, 1 out of every 5 women, age 40 to 44, was childless, compared to only 1 out of 10 in 1976. They think a lot of this contributes to the expansion of work opportunities and women in managerial positions, as well as more effective contraception and easier access to abortions than previously. And then there's a new emerging role from therapists that have found a niche in motherhood clarity mentors, where they meet with women and help them decide if they would like to become mothers or not. This theory stems from family life cycle theory, which discusses the stages of life from childhood through retirement. It focuses on the challenges and milestones of each stage, reminding us that if you do not hit a certain milestone in each stage or do not acquire a certain skill set, you can still learn it later on. It just is a little bit more challenging to accomplish that. I just want to briefly touch on the stages of family life cycle theory. There are quite a few and they go kind of in depth. But we have independence, when you develop your individual identity, be able to fully support yourself emotionally, physically, and the like. Also developing intimacy, compatibility, and attachment, and learning how to depend on someone who's a non-family member. Then you have coupling and marriage, which forms a new family system with new ideas and expectations. You've now reshaped your goals to kind of align with your new family and your new life. Interdependence is the biggest goal in this stage because you want to learn how to live within that relationship that you've just created with those new goals and the new expectations. The parenting stage, which looks at babies through adolescence, and the skills that have been missed in prior stages are tough to gain in this stage. You can still gain them, but you're busy learning about how to be a parent. They also start to think about older generations in the family. Then we have launching adult children, where we find empty nest, developing relationships with that adult child, and health issues that may arise as the parents begin to age. And then finally, the retirement and senior years, where they provide support for older children and begin to deal with loss, potentially of a spouse. Refining the definition of the parenting stage is what Pelton and Hartline did with their 2011 study. They outlined that the choice to have children has been around for a long time, and they explore some of the psychosocial and societal stigmas that come from the choice of not having children. They choose to use the verbiage child-free life, as this suggests that these individuals can still live a carefree life where they are not burdened or suffering from missing something childless used to imply. Couples will still pass through the parenting stage, it's just a little bit different and in a newer way. They also focus on cyclical decision making, emphasizing that living a child-free life is not a decision made early and definite. It is a choice made over and over. If we look at Pelton and Hartline's definitions, they describe family as any couple living a child-free lifestyle. Health is defined as an identity of a child-free couple, role development, therapeutic goals that many other couples with children also have. The environment highlights social norms and stigmas that may be attached to this lifestyle, and as far as nursing, considering our own personal beliefs and biases to ensure effective care when interacting with this growing population. Looking at Pelton and Hartline's proposed life cycle, we have 4 points. Point number 1 is the decision-making process. These couples have made a conscious choice not to have children, so they're not living in a world of indecision. They are managing their stigma, which can come from coping with the pressure of society, family, and their friends. They're defining their own identity, carving out that adult identity that's not associated with parenthood, as well as creating a deeper role development in their own relationship as a couple. And then finally, building support and leaving a legacy, meeting other couples their age that don't have children, as well as maintaining involvement in their community as they age. They look at data that supports couples on each side of the fence. Some couples love the choice that they've made, citing that they have more freedom, a better relationship with their spouse, more time to pursue their interests. While on the other hand, there are some couples that do not love it and they report more loneliness. That was the top answer in many of the surveys. They feel like they lie on the periphery of society as they're not interconnected with people that do have children. And later on down the road, couples will end up with a sense of regret or what ifs. again through certain life milestones such as a new job or marriage. And they also point out that some couples may not even pass through this stage at all. This theory has led to some studies, one of which was the university students' perceptions of parents in childless or child-free couples. I'm not even going to attempt to pronounce their names, but this study was done in 2015. These three performed a study using college-age adults on a college campus using hypothetical vignettes. They were to review perceptions of childless couples versus parents and negative bias associated with each one. They looked at the relation of gender to parental status, and then perceptions of when couples choose not to have children in the future. These students were given these vignettes with different types of couples outlined, all heterosexual, and they either had children or they did not. And the researchers compared these rankings using a scoring system that they had developed from previous research. What these three found were that mothers and fathers were regarded to be more emotionally warmer than those with no children. The parents were thought, however, to have more marital struggles, and mothers and fathers were found to be more stressed or anxious. Female students viewed the childless couples with more positive marital relationships. That was about the only positive thing that came out on the side of no children. Child-free couples were thought to have more negative emotionality. Male students found childless husbands to have more negative emotionality than fathers, and women with no plans to have children were described as less nurturing, less warm, and less feminine. This study was a little bit similar in the population that it examined. This one was called Parenthood as a Moral Imperative, Moral Outrage, and the Stigmatization of Voluntary Child-Free Women and Men. This was done in 2016, and this researcher found a similar approach to gathering the data, found college students from an Introduction to Psychology course. In exchange for completing this research study, they were given research points towards their class. They were told they were going to be reviewing alumni data from the university's database. All of the alumni that they looked at, they were all fake alumni, by the way, either had 0 children or 2 children. They were told to use a 7-point scale, the kind that ranks from extremely likely to extremely unlikely, to answer questions about these fake alumni and his or her psychological fulfillment. This researcher found some similar data. The fake alumni examined with 0 children were thought to be less psychologically fulfilled than those that had 2 children. Moral outrage for those who had 0 children, and remember the moral outrage used words like disgust and anger. This also was the first empirical support that parenthood is a moral imperative, something that we've been kind of socialized to believe is something that we have to do as women. And the child-free males and females were stigmatized equally. In the last study, the females were usually given a higher sense of stigmatization. They were thought to be less feminine, more money-driven, and less sensitive. So looking at how we as nurses can provide compassionate care, Pelton and Hartline lay out that most of their data is aimed towards therapy and recommendations for therapists as far as elective communication goes, but I think we can also learn from them too. We can help them to cope with the stress of their stigma in society. We can help them rewrite their gender roles. Many women do feel like they're less feminine because we have been raised thinking that having children is the only path for us. We can also teach them to focus on themselves instead of outside forces, because the outside forces tend to come from everywhere, like I mentioned before, society, family, all that as well. There does seem to be a fair amount of research kind of coming out about this. Our own textbook doesn't cover it, but we might find these individuals in a similar category of family care. We'll see them in different settings, obviously, not in a pediatrician's office, but the OBGYN, primary care, acknowledging that people haven't necessarily made these choices because they wanted to, and be compassionate to those who have made them because of personal preference. Understand that some may be happy with this choice and some may be unhappy with it. And just being respectful in regards to our own opinions based on how we feel about children in our own lives. So conclusions and takeaways: this population is continuing to grow, especially with that millennial generation. The family that I have chosen for my assessment project has suffered from 2 miscarriages, and their son has decided he would like to live a child-free life. So I hope to incorporate the overarching family life cycle theory and explore a little bit about them in their empty nest stage of life. Thank you guys for listening. And how they had adjusted in life. They also completed a section on moral outrage, which they the authors said they just kind of tucked in there so they wouldn't be as aware of this potential moral situations they were putting them in. And these questions asked if the fake alumni made them feel outraged, disgust, angry, or annoyed. Like I said, they did not ask these questions outright. They sort of hid them in with the rest of the stuff they were looking at.